Hello, my name is Pranav Kancherla, and I'm part of the Health Needs RX Spotlight team. We are an organization with a mission to empower people to make their own healthcare decisions. We create video content and information guides on essential topics, including chronic diseases, mental health, health literacy, and more to help people optimize their health more efficiently. Today, I'm joined with Dr. Shah, who's a pediatric dentist, and he will talk more about dental health. Thank you so much for joining us today. So I know you had a couple slides to go over about yourself. You want to go over those quickly? Thank you so much.
Sure, of course, Ronald. Thanks so much for having me. Hey, everybody. I hope everyone had a wonderful Thanksgiving. So I'm just going over a couple slides here. I have that entire presentation, but I know we've got some questions I want to address. So I'm going to go over just a little bit of background in terms of who I am, where I'm from, kind of the academic that surround becoming a pediatric dentist, and just shed some light onto that. So once again, like Pranav said, my name is Deep Shah. I am a board certified pediatric dentist. I am part-time in private practice, and the other part-time I'm in academia. And so who I am is I'm a husband. I'm a father of two boys, and I've got a golden doodle who's 4 years old. And so in my free time, I love playing sports, staying active. Unfortunately, with COVID, traveling has been a bit limited, but pre-COVID days and hopefully in the near future, get back to traveling a little bit again. And then I also just love reading, whether it's podcasts, listening to podcasts, physically picking up a book and reading books on mental motivation, certain finance things. So that's a little bit of what I like to do in my free time. A fun fact about me is that I danced competitively throughout undergrad and grad school, which is really, really fun. I had a chance to actually go into Bollywood as a background dancer, but I was in dental school and decided to hold off on that. But yeah, just a neat fact that I thought I'd share. Now, in terms of my professional life, as I alluded to earlier, I practice in private practice. So currently, I don't have my own practice, but I am an associate and a location called Exton, Pennsylvania, which is the suburbs of Philadelphia. And then also I'm in academia. So I'm a faculty at the University of Pennsylvania School of Dental Medicine, as well as CHOP, which is a Children's Hospital of Philadelphia. In terms of my schooling, I went to Drexel University for undergrad. That's where I did my major in biology, but I also got a minor in business administration. And then followed by that, after matriculation of 4 years from there, I went to grad school, aka dental school at Penn, at the University of Pennsylvania. I did 4 years there, and upon completion of my 4 years there, I ended up doing 2 years of residency. And for my residency, I ended up going to the Children's Hospital of Pittsburgh of UPMC, which is located in Pittsburgh, Pennsylvania. Really a solid program, which laid the foundation in terms of what I do right now. And I learned a lot in terms of the profession in the pediatric realm during my residency. And so I graduated in 2015, and I've been, sorry about that. I graduated in 2015. I've been in private practice since 2015, and I just joined faculty at Penn in April of 2019. So that's a little bit about in terms of me, my background. And then a quick thing, I guess, a day in the life of me. My private practice hours are like 7:30 to 3:30. I do a lot of oral conscious sedation cases in the morning. So these are kids who need a little bit of medication intervention to help them relax. And so we physically give them some medicine to drink, which helps to kind of help alter their state of mind, where I'm able to kind of get in and help take care of their dental needs for them. And I'll see a full array of treatment. So a lot of people associate dentistry with, the filling, the drilling, but there's a lot more crowns, there's extractions. Nowadays with, we're moving to the 21st century, obviously, there's a lot more emphasis on cosmetic dentistry. So there's a lot of like white crowns that we do, different types of, white crowns, not only in front, but also in the back of the mouth. So aesthetics is kind of becoming a very big and upcoming thing. And then every few days, or I say every few weeks, I do something called an IV sedation. So instead of having these kids in a hospital setting, I have an IV anesthesiologist who comes to me, and we sedate these kids fully. So they're fully asleep under general anesthetic, and I'm able to do a complete full dental oral rehabilitation. So a lot of these kids might be 3, 4, 5. They're just not cooperative enough to sit in the dental setting, sit in the chair, or they have some underlying medical conditions, which doesn't make it safe, for them to sit in the dental chair. So we're able to really just take the fear, anxiety out of the question and just do some really good treatment while they're fully asleep. And then in private practice right now, I'm actually becoming clinical director of the company I'm working for. So I'm looking forward to that role and kind of making sure all of the offices that we have work together. Now, in terms of academics, I work predominantly with the residents. So there are a group of 8 residents at the University of Pennsylvania School of Dental Medicine. I run their oral conscious sedation program. So every morning that I'm there, we sedate kids. I get them comfortable with using the medications, seeing and showing them how the medications work, interact, and how that can help facilitate treatment and care. And so that's pretty much what my role is there. I run their morning seminars on Friday mornings. So we'll sit down and go over different topics in dentistry. A lot of it's pertained to pediatric dentistry because that's kind of what they're specializing in. But a lot of this overlaps with general dentistry, orthodontics, other facets of the dental field. And so it's a great way just to kind of help shape today's generation to become professionals in the near future. And so that's just a little bit about kind of my background and what I do.
Yeah, thank you so much for sharing all that. It's amazing that you have like a private practice and you also help with like academia as well. Thank you so much for sharing that.
You're very
Um, so I had a couple of questions to go over as well. So what would you advise a person who wants to start taking better care of their teeth now? Like what first steps would you recommend?
Yeah, so oral care is very important. So the biggest thing you want to do is just make sure you get into a good routine. So I think routines are great. If you're someone that doesn't brush every day, then something that you might want to focus on is brushing at least once a day. The goal is to get to 2 times a day, morning and night, but take baby steps along the way. Just like anything in life, you don't want to bite off more than you can chew. So start with brushing once a day. I always say night brushing is the most important time to brush just because when you're sleeping, your mouth can get dry, especially if you're mouth breathing. And it's a whole 8 to 10 hours if you're sleeping at night of bacteria to grow from all the day's food that you've had. And then if you just sleep without brushing, it can just wreak a lot of havoc. So when your mouth is dry, that's kind of when the cavities will form. So there's a formula that I would say just to kind of keep in the back of your head. And that's sugar plus bacteria equals acid. And that acid is what gets produced at night by the sugar bugs, I call them. And so that's kind of what you want to make sure is making sure you brush every night before you go to bed. And then you want to just brush every morning. So your goal is to brush twice a day. You want to floss once a day before you go to bed at night. You can absolutely use a mouthwash, whether it's, I like to use an anti-cavity mouthwash. If some people want to use a mouthwash like Listerine, that's okay. Just realize that Listerine has about 22% of alcohol concentration in it. So it makes your breath feel really good for the first like half hour. But if you know alcohol, anytime those of you who are let's say drink, you know that alcohol can dehydrate you. And so alcohol in the mouth is the exact same thing. It'll actually dehydrate the mouth and make the mouth more dry. So long term, you probably don't want to bank on Listerine as being your go-to because it will dehydrate the mouth and can cause the mouth to dry out. But it's all about taking good care of your health, your home care. And so the brushing and flossing is the most important thing.
Yeah, so what routine dental care activities should people do? Like I know you mentioned like flossing and like types of toothpaste, but what's like essential for like a dental care routine?
Yeah, so a toothbrush for sure. You got to have a toothbrush. If you can get a spin brush, I'm a big fan of getting the electrical or the spin brushes. They just do the work for you. There's no one better way, but I think a lot of people who have a manual toothbrush think that brushing hard and aggressive is the right way, and that's not the case. You want to brush very, very gently, angle your toothbrush, and kind of point it towards the gum and go in a circular motion. So it's a little bit more technique sensitive. If you're able to, use a spin brush, they're very, very cost effective. You don't need to buy the Oral Bs, which are 150 bucks, online. You can get something that's just as efficacious at a Target or a Walmart, like $15, $20, and they'll do the trick. They probably are battery operated. Just got to change the battery, every couple of months. But that really does, I think, a really good job in terms of taking away the power, so to speak, out of your hands in terms of you brushing overly aggressive. The RPMs generated by the spin brushes will do the work for you. And so that's kind of what will help you. The other thing is if you have a brush, it's very important to brush the tongue. I have a tongue scraper or a tongue cleaner. It's one of the most important things I actually recommend, especially when you wake up in the morning. It's also brush your tongue or scrape your tongue. Our tongue is a biological niche which harbors a lot of bacteria. And so a lot of people, if they wake up and they brush their teeth, they're just like, my breath still smells bad. So, consider brushing your tongue or getting a tongue scraper to help eliminate some of the bacteria and the odor that comes from the tongue. I think you'll see an improvement. So the brush, we've had tongue scraper, floss for sure. Flossing is so, so important. I can't flossing gets so undervalued. I probably think it's more important than brushing because you're able to get in between the teeth. And that's something that the bristles of the brush just don't do. And the floss does do. So whether it's the floss picks, if you have kids, you can get in between there. If you're an adult and if you're able to get the floss, you're able to wrap around your fingers and go in between with that. That's great. Those are the three must. Now, other things that are good to have or nice to have is like a mouthwash. An anti-cavity mouthwash is fantastic to help prevent cavities. If you have a water pick, that's also great. Just remember, it doesn't take the place of flossing, but it's a great way for high pressurized water to get in your mouth and help to loosen up debris. Like I said, if you want something like a Listerine, although they have a lot friendlier versions of things out there, they're not as alcohol driven. You can use like a mouthwash that helps like kind of eliminate odors and bacteria. Those are all nice things to have as well. But if you're using that and you're not brushing, you're kind of negating everything. So my three most important things are toothbrush, tongue scraper, and floss, to recap.
Yeah, that's awesome. And what advice would you give to parents who are having trouble getting their children to brush their teeth? And I know you were kind of talking about this before as well, but
Yeah, that's a great question. So I think it's kids love to play, right? Like they're all about playing, and they like to get engaged in things when it's fun. So I tell parents is bring out your inner child during these sessions at nighttime and at morning time when you brush. Play a song, dance around, like get involved, make it a fun ritual or fun routine. Sometimes some kids need a little stimuli. So every time the child lets you brush their teeth, they get a sticker. You can make a sticker chart, and for every week of brushing that they let you do 5 stickers, they can get a small treat, and whatever you deem appropriate as a treat can be the case. But make it fun, make it engaging, and I think as long as you do that, it'll drive your child to really reciprocate and respond. And so I would say make it like a family thing, make it fun, sing songs, have a timer on your phone, listen to like a YouTube video that or their favorite song about brushing or any song in general. But it's all about making it fun.
yeah, and I know you were sort of talking about this again, like before, about like, proper brushing and flossing technique. But do you have like any advice on how people know if they're like doing it correctly? And also, if they have braces, how they could do it correctly as well?
That's a really good question. So there's something called the BASS technique. Um, I'd say in a day of technology, it's very easy to go online on your phone or Google it on your laptop. BASS technique. It's a circular motion technique and kind of goes around. You're going around your teeth and gums. So you'll know that at the end, when you pull your teeth down, you don't want to see any residue around the bottom of your teeth or the top of your teeth and where your tooth meets the gums. So that's the biggest thing, which is why I like the spin brushes, because they kind of do the work for you. The other thing is flossing. If you don't floss regularly, you'll notice that every time you floss your teeth, you get a little bit of bleeding. That's just something called gingivitis, which is anything that has itis at the end means inflammation. So gingivitis is inflammation of the gingiva or the gums. That will absolutely heal itself in about 2 weeks. So you have to be consistently flossing your teeth for about 2 weeks until you notice that, hey, when I floss now, it doesn't bleed. It's because your gums have actually healed, they've tightened, you don't have any bacteria that's in between there. And so as a result, your gums aren't going to be as red or as inflamed looking anymore, and they'll be a lot pinker looking and a lot more taut and tight, and that's kind of what you want. So if you keep up with it, those are the things that you're going to see physically. You're going to not see the plaque around your teeth anymore, and when you kind of floss your teeth, you'll notice that your gums don't bleed or they don't easily bleed anymore. And those are kind of signs that you'd see.
Oh, and going off of that, like, did you have any like specific websites or resources that you would recommend as well along with that?
Yeah, you can. It's a good question. You guys should go on to the AAPD, which is the American Academy of Pediatric Dentistry. And I think they have a whole section there for like educate. Like we'll have one for educators, but they have one for families and the general public. And they have, I think, great activities and a lot of awesome resources on that website. So I think it's aapd.org.
Yeah, and also, how can people find like the right toothpaste? Like, is anything on the market work, or is there certain things that people should look out for?
This is a great question. So during quarantine, I spent my 3 months reviewing and evaluating toothpaste. And I've come to the conclusion that I personally, I'm not a big fan of Colgate and Crest. And that's going to be a shocker to many of you because that's what I grew up on. I'd probably say 99% of people that are watching this have used Colgate or Crest or are still using it. There are a lot of ingredients in these products like Crest and Colgate. One of them is SLS. It's the agent that makes your toothpaste foam. So when you're brushing your teeth, it foams up and you're like, oh yeah, my teeth are getting clean because it's foaming. Well, fun fact here is that SLS is also used in your dishwashing soap. It's used in your laundry detergent. Anything that causes bubble, your hand soap. So anything that causes bubbling is due to SLS. So if you think about it, you're putting that caustic agent in your mouth. And so what I've actually come to the realization is I've stopped using a lot of these products that have SLS, that have carrageenan, that have parabens, just from studies out there to show there could be potential carcinogenic effects. I think earlier when I first introduced this, my presentation, you saw at the Superhero Dentist, so that's my Instagram handle. I have a lot of information on that. And I just bring that up right now because I actually have a couple of posts that talk about the top toothpaste that I recommend and why I recommend those toothpastes and what ingredients, especially what ingredients to be mindful of and kind of stay away from if possible in toothpaste. So if you're able to, go on to that handle, you'll find one of my posts that goes over that. Feel free to shoot me a message. But if I were to talk about this in depth right now, I think it would easily take up about 30 to 45 minutes of this conversation just because there's so much information on there. But yeah, I think that's kind of my go-to is that there's some really awesome all natural toothpaste that I believe in that are okay for your child or even for you to swallow accidentally, and it's not going to cause any harm and you're not putting toxic things in your body. One analogy I'll quickly give to you guys, because a lot of people might be skeptical and they're kind of like, I've been fine, I've been doing it okay. And you're right, like, everything in healthcare is a bell-shaped curve, and majority of us are on this part of the bell-shaped curve, so we'll be okay. But what I tell people is that when someone has a heart attack or they're having heart pain, the medicine of choice usually, for something that severe, besides like chewing on like 481 milligram baby Advil, is going to be something called nitroglycerin, which really helps to subside an attack. Nitroglycerin is administered sublingual, which means it's given below the tongue. So why is something that's given for your heart given through the mouth? And it's because things in your mouth and your mucosa can absorb things that fast, very, very rapidly. So what that tells you is what you put in your mouth, especially when it comes to toothpaste and other ingredients, is very important because it can also get kind of, not just metabolizing, but kind of get past that mucosal barrier into your bloodstream. And so you want to be very, very mindful in terms of what you're putting into your body. And I'm a big believer on, hey, if you can optimize your health and well-being, whether that's eating the right food and diet, also knowing what you're putting into your mouth in terms of your dental care, it overall just helps you perform at your most optimal level and optimum prime in a way. And so that's why I kind of bring that up.
Yeah, and thank you so much for talking more about that. And also, how can people safely whiten their teeth? Because I know there's like a lot of like cosmetic ads about like tooth whitening and stuff like that. So do you have any advice on how people can like safely do that and not like, overexpend as well?
Yeah, so there's some of these toothpaste I mentioned. If like there's one out there called Coral. It's all natural. It's great. It actually helps whiten teeth. I've used it. It's been great in terms of whitening. You can also use it at home if you want to use a little bit of baking soda and brushing with that. That's totally fine. Those of you who are thinking about, hey, whitening your teeth, like I said, I think everything in moderation is okay. So if you want to get your teeth whitened, they have those crest strips that you can get like over the counter. That's okay. That's kind of like a very low budget way to go about it, and they're super efficacious. You may have a little bit of more discomfort or sensitivity because those strips are almost a one size fit all type of model. So if your teeth are too small and you have a lot of gum showing, your gums might get covered in the agent, the whitening agent, and that can cause your gums to burn and have sensitivity. Or if your teeth are too big, not all your teeth will get covered, and so some parts may not be as white as the others. So the best way to go about this, if you're really interested, is like once a year, if you want to, go see a professional dentist. They have something called Zoom whitening. Really funny, we're on a Zoom meeting, but it's called Zoom whitening. And so what they do is they'll help retract your cheeks so your teeth are showing, and they'll put gel specifically on your teeth. They're washing it off, and they have this UV light that kind of hits the area where the gel was placed. So it is the most precise way of doing it. It also lasts the longest with good home care. I think it can last the whitening effect of those teeth can last up to 6 to 8 months. So it just depends on, hey, if you're a big time coffee drinker, you might stain them a little bit quicker. But if you're taking good care of your teeth and you're not drinking beverages that can cause staining, then you can actually get a good half a year worth, if not a little bit more time with that whitening. So that's a great way about going it. If you look at cost effectiveness, it's really not that much, especially if you're going to take good care of your teeth and you're going to, it'll last you a good 6 to 8 months. I think the cost definitely outweighs, kind of the price point at that point in terms of longevity.
Yeah, and I'm gonna touch on this again about like social media again, but I know there's like tons of ads on like, dental care products and like influencers like promoting certain dental brands. So like how can teens and adults kind of distinguish between like harmful slash effective products and who and what should people consult for reference?
Yeah, that's tough, right? Because everyone out there, influencers out there who are, they may be affiliated with a brand, they're promoting it, for a brand. I mean, the biggest thing here is I think you have to do your own reading, and you have to put the time in and understand what you're putting in your mouth or what a product entails. So in a day and age where I think everyone's very savvy about reading food labels and nutritional labels, you kind of want to do the same thing in terms of what you're using in your mouth. So some of these words in the dental field are just very complicated. There's abbreviations for elongation of certain words. So you really just want to spend time, Google it, see what these do, and just kind of figure out, hey, like what's the first ingredient, second ingredient, third ingredient. It's almost everything is like ascending order. And if you have any questions, I would definitely just, like I said, reach out to your a dental expert in the field, whether it's the dentist that you see, whether I say if you want to reach out to me and ask me questions, I'm more than happy to help answer your questions as well. But if you're really on the fence and you kind of want to get a better idea, definitely reach out to a dental professional to kind of get their expertise and their expert opinion on that. But it's a great question because a lot in a day and age where people are promoting things, yeah, some people have financial gains in terms of promoting something, and so they're going to be all for it. But I think you have to use your best acumen and your best clinical judgment in terms of what you're looking at. And sometimes the trial and error, you might try a product and realize, hey, it was a little bit too harsh for you, and you kind of step away from it and you try something else. So there is some trial and error involved. But at the end of the day, I think you can't put a price on educating yourself and reading into what you're putting into your body.
Yeah, absolutely. And it's super important as well for like, from a budget point of view as well. So, when should kids like consider getting braces and like how long do they take to work and how expensive do they tend to get?
Yeah, that's another great question. Yeah, you got some really good questions here, Pranav. This is a very tough question because it depends on the overall assessment of your mouth and the crowding of your mouth. So braces can start as early as 7 or 8 years of age, especially if you have a lot of crowding going on. Generally, an orthodontist is going to want to see your 6-year molars come in. They call them 6-year molars because they come in around the age of 6, give or take a few months here or there. And they want to see your top 4 teeth and your bottom 4 teeth, kind of an anchor to kind of help consolidate space. It can start if you start it that early. It's called phase one treatment. So the goal there is to just help align those front, the front four teeth on the top and bottom, and let those back teeth and let your jaw keep growing. So if you're 7, 8, 9, you got to realize that if your child's that young, you're gonna keep growing till you're about 16 to 18 years of age, especially that lower jaw is the last thing that stops growing. So you have a lot of growth and development left ahead of you. But it can start as early as 7, 8 years of age and do a phase one or interceptive orthodontics. Once that's done, it doesn't mean that you're out of the woods or you're in the clear. You might need a second phase of orthodontics. That happens around the age of 12 or 13. Now, some kids might not need the first phase and they'll need the second phase of ortho. So they'll go right to kind of complete orthodontic care around the age of 12 or 13. General timeline, I'd say roughly anywhere from 24 to 36 months. So you're looking at 2 to 3 years on average. It just depends on how your teeth are, how much straightening that needs to be done. Usually conventional braces is what most people opt for. But as I alluded to earlier, in a day of aesthetics, and that's kind of where we're getting to, I'm sure you heard of Invisalign. And so Invisalign's also been an up and coming thing. You kind of need to make sure your teeth have to also fit the Invisalign model. So not everybody is going to benefit from Invisalign, especially if you need more comprehensive work. The traditional orthodontic wires do provide a better strength in terms of moving teeth and really guiding teeth into the right spots. Invisalign is a series of trays, so it essentially eliminates the need for you to go to the orthodontist often for follow-ups. Every 2 or 3 weeks, you move on from tray 1 to tray 2, and it should shift your teeth. So as you go along, the trays will kind of match a computer model that's been generated in terms of how your teeth should progress and align. Those sometimes can take a little bit longer. It all just, once again, it depends on just kind of your makeup of your mouth and how your teeth are positioned. But on average, I'd say about 2 to 3 years in terms of orthodontic care.
And also like how necessary are braces and should people really, have to invest in them?
Yeah, it comes down to two things. So you can have braces for aesthetic reasons or functional reasons. And that's kind of the one thing, is that most dental providers should be able to tell you, or your orthodontist should be able to tell you. So aesthetic reasons means that, hey, when you bite down, your teeth are functional. They're in the right spot. You know, that you're not having a shift. Like a lot of people when they close their mouth, they might deviate one way or the other, and I'm exaggerating here, but that tells you that your teeth are not lining up the proper way that they should be from, you know, back left to back right. And that's a functional reason. If you have any functional reasons, you want to correct that, because that can lead to one side of the jaw growing a little bit more than the other. You having some TMJ and jaw issues as you grow older. So those things you definitely want to nip in the bud ASAP. Let's say your teeth are totally fine, but you might have a little bit of a gap in between your front two teeth, or a gap somewhere in the back here. Now that just becomes cosmetic or aesthetic. And for those reasons like that, that really just becomes kind of a choice of the beholder. And so that's something that you would have to discuss with yourself, your family members, and see, hey, is it really worth me getting the braces? Do I want them? And it becomes more of a personal choice at that point. So those are your two reasons in terms of, you know, why someone would opt for getting braces, or maybe opt not for getting braces.
Yeah, and also like for adult braces, like can adults like actually wear braces, and how effective are they?
Yeah, so you see a lot of adults nowadays, I think, especially in a day like so with COVID where everyone's wearing a mask. I've actually seen a lot more adults wearing braces because everyone's wearing a mask so often that if there's a time to get dental work done, get dental work done, it's now, because you're able to wear a mask and kind of hide things. I've seen a lot of adults wear braces. They are effective. Once again, you know, as an adult, your jaw is pretty much formed, so it might take a little bit longer in terms of where you want teeth moved or what the end goal is. But adults getting braces is absolutely not out of the question at all.
Yeah, and also this is a bit of a shift, but like how can kids like also prevent cavities?
Hmm. Yeah. So my biggest take on this is diet. Diet is the number one most important thing. I would probably say one analogy or one fun fact I like to bring up with this is if you look at the cereal, which I'm sure we're all familiar with. If you look at Trix back in the 1980s, they only had three ingredients in terms of three colors that Trix had. If you look at Trix now, I think they've added 8 more like ingredients / artificial flavors. And so what you've seen is like from the 1980s to where we are now, these past like 30 years, everything's become eye candy, right? So the more colorful something is, the more it pops in your eye and catches your attention. And so because of that, there's a lot more food additives, there's a lot more sugar in today's day and age. And so the biggest thing here is going to be diet. So you have to be very mindful of what you're consuming, what you're drinking, you know, all these sodas, all these, even Gatorade, all these different colored, you know, now they have all these like energy drinks out there, you know, with different flavors. And all that stuff has sugar in it. It didn't exist, you know, years and years ago. It started existing now. And so that's the biggest thing is your diet and your sugar consumption. Next thing after that is just brushing. Brushing is super, super important. So you want to make sure that you're using, you know, toothpaste. You want to make sure you're flossing. You want to make sure you're brushing the right way. You have good oral hygiene, oral home care. And really, you know, those are the two biggest things. You're monitoring what you're eating, how much you're eating, and what you're eating with the sugar content and, you know, the nutritional label of it. And then also backing that up with brushing. And, you know, even if you eat something healthy, even if you eat something healthy like a salad, right? It's still carbs. So if you don't brush your teeth after eating a salad and there's food that's stuck in your teeth, well, guess what? That'll still cause cavities, even though you're like, oh, I had a salad. It's a healthy food. You're right. But if it gets stuck to your tooth, you don't want that there. So you definitely want to back that up with some good home care.
Absolutely. And I'm going to shift a little bit more to like oral health and like mouth. So, what sort of things should people look out for in terms of their oral health, and what things should like receive more attention? And
What they should look out for?
mhm.
Hmm, that's a good question. I'm trying to think in terms of what they should look out for is I think these gimmicky products. There's something called out there called the Quip. It's like a mouth guard brush that you put in your mouth and it's supposed to clean your mouth for you. I'm not a big fan of those gimmick things because once again, every mouth size is different. The way everyone's teeth are aligned are different. So that Quip may not work for you. So as much as these gimmicks and gadgets look really cool, once again, eye candy, they look really awesome. They attract you. They're not necessarily doing the best job. So I would say the best thing here is conventional brushing, either manual toothbrush or electric toothbrush, and, you know, just having a hand on it, you know, and refining your motor skills and letting that do the work there for you. Um, and then on my end, I said the only thing that I always say look out for is just read the ingredients in terms of what you're using, what kind of toothpaste you're using, what's in your mouthwash. You know, to me, especially to me, I'm not a functional dentist, but I'm a lot more holistic in terms of my care. So my goal here is to get to the root cause and something, like why did something happen? So one of the biggest things I mentioned SLS, a couple of minutes ago, one thing that SLS does, it's notorious for causing mouth ulcers or canker sores. So if you're someone who's brushing your teeth often, you're like, I keep getting canker sores. They come, they last for about a week or two, they go away. Now they come up here. They last for a week or two, they go away. Okay, now next time it comes over here. That's usually due because of your toothpaste. And it's due to the SLS component of the toothpaste. A lot of my patients who have removed SLS from their toothpaste, they've stopped using the Crest or the Colgate, have stopped getting mouth ulcers. And so there's a lot of correlation between a lot of these things that I've noticed. And a lot of, I think it's this type of knowledge, I think, is coming now to the forefront of dentistry. So I think a lot more providers are in tune with it. So, I mean, those are things like, those are my immediate takeaways that come to my mind in terms of, the don'ts and what to kind of stay away from. The second part of your question was what to do, I believe.
Oh, it was just more about like what things should receive more attention. Like if you notice anything in your mouth that's like on there for too long or something that's concerning.
Yeah. So, I mean, I think anything abnormal, right? So I think if you have a pimple or a bubble around your gums, and you have a tooth pain, and all of a sudden your tooth pain goes away, but you notice a pimple or a bubble around your gums, an abscess, that immediately I think you should go see a dentist and kind of have that checked out. Biggest thing here is be in tune with your body, be in tune with your mouth. So if something feels wrong or something hurts or aches, just get it checked. Better safe than sorry. One of the biggest things, if you are someone who smokes a lot of cigarettes or is a big tobacco user, you're at a higher risk of oral cancer. And the reason I say that is it dries the mouth out. If you're pouching around the gums here and underneath the tongue, to get that, like a lot of people park things under, like I said, in those areas. That's where it gets into the bloodstream and you get that high. Those who are tobacco users aren't totally understand what I'm saying. You're at a very high risk of getting oral cancer of the tongue or oral cancer, kind of like of the jawbone and things like that. And that can just be very, very dangerous. So you want to be very mindful and see if there's any changes or discoloration in the tissue. So do an oral exam, on yourself. More importantly, make sure you're seeing a dentist twice a year. That's kind of what's recommended for anyone, whether you're, 1 year of age or all the way up to 55 years of age. You want to see a dentist at least twice a year, and they'll do a complete exam on you, get x-rays where need be. The x-rays are important because they'll detect if there's any changes in the bone. So if you're at a high risk, someone who's, chronically smoking or chronic tobacco user, you're at a higher risk of getting, like squamous cell carcinoma or, getting like oral cancer in the mouth. And yeah, I mean, it's my job to let you know it is deadly. I have seen people die from it. I've heard a lot of people die from it. So just one thing, just not to take lightly. At the end of the day, I understand. I respect everyone's choices. That's your choice. But just making sure you also are aware of what comes, what are the kind of side effects, so to speak, that come with that decision choice. And those are things you just want to be a little bit more mindful of.
Yeah, absolutely. And our next question is actually about oral cancer as well. So how can people like identify oral cancer early? Like what are risk factors and symptoms that people should look out for?
Yeah, so you really can't identify it early. The only ways I think anyone will identify it is like your doctor or your dentist. They'll do an exam. They'll probably do a biopsy if they feel like there's something going off that's off. Now, you might see if it's a very, very large area, you just might notice some discoloration in the area. You may not notice anything harmful. Nothing probably doesn't even bother you. For it to get to that point of metastasis, it takes time. So the initial thing of the early signs, you're really not going to, be able to detect it, but you're going to have to do a biopsy, and that biopsy will be done by your provider. And that'll tell you right off the bat, hey, if there's something going on. But the only thing you can do on your home front, if you're at a high risk for it, like I said, smoking, cigarettes, if you're a tobacco user, that puts you in the high risk category. So if you're one of those and you just want to do an exam on yourself, just keep an eye on things. And if you notice that there's something off, it's worth bringing to your dentist's attention. Other than that, you want to go every 2 weeks, so that way your medical provider, your dental provider can do a full mouth assessment and keep an eye on those things.
Yeah, absolutely. Thank you so much for joining us on this episode about like dental care. It was like an honor to learn from you, and thank you so much for educating our audience.
You're more than welcome. Thank you so much for having me. I really appreciate it, Pranav.